We welcome you to this second webinar session for this year conducted by Andhra Pradesh Adolescent Health Academy. I have to convey my thanks to Dr. Sai Prasad, who's such a dedicated secretary. And he's been, pursuing all good speakers to address us and educate us on various adolescent issues. Today's topic, life skills with special reference to substance abuse leading to criminal tendencies in adolescence, is going to be delivered by none other than our Dr. Preeti Galagali, Madam, adolescent specialist from Manipal Hospital, Bengaluru. And this is going to be chaired by Dr. K.V. Raja Ramesh, consultant adolescent health advocate from Vizag. As we all know, 15% of adolescents between 10 and 17 use some form of substance or the other. And 60 to 70% of the juveniles are in conflict with the law and have history of substance abuse. NIMHANS, in a study 2021, has revealed that 1 in 3 adolescents with substance abuse show aggressive and antisocial behavior. So, early initiation of drugs below 15 shows that there is an increased risk of addiction and is strongly linked to criminal behavior. So, it is very essential for early identification, life skill training, counseling, and timely intervention to break the cycle of addiction and crime destruction and build a healthy, law-abiding generation. And now I request Dr. K.V. Ramesh to chair this session. Dr. Ramesh is lead pediatric, is a consultant adolescent health advocate from Vizag. And he has experience in pediatrics for more than 12 years. And he's done his PG from Kanchi Kamakoti Child Trust Hospital, and past secretary, past treasurer of IAP Vizag, and he is IAP AP vice president currently. And he has spoken in several national and state pedicons from 2020. Over to you, Dr. Ramesh.
Yes, ma'am. It's a great pleasure to introduce Preeti Madam today. So, as we know that there are so many adolescent problems is there. So, some people are good at academics, some people are good at publications, some people are good at social work. But Madam has all three. If you go through the Madam CV, it's very difficult to tell in like a 5-10 minutes. Is a huge CV, but we have to feel proud that Madam is one of the member of WHO in adolescent health education, and she's supporting it. She's author of so many books. She given more than 300 scientific talks, more than 130 scientific publications. She received 4 orations. The most important is that she's the lead author of IAP clinical guidelines in adolescent health, co-author of 10 international position standards. She is a gold medalist during her MD pediatrics. So if you like that, this big list is there. It's our privilege to have today, Madam. Please, Madam, please welcome to the today's session.
Thank you so much, Dr. Ramesh. It's indeed a privilege to talk today to all of you on the Andhra Pradesh State AP Chapter Forum. Thank you so much, Dr. Sandhya, Dr. Sai Prasad, for inviting me. And I wish all the delegates here who are a very warm evening. It is indeed very warm. And let me just share my slides.
Not only warm, it's very hot.
Exactly. So somebody was saying you should not say warm greetings from now onwards. Maybe we can say icy cool. So let me jump right into the topic and life skills, prevention of drug use and criminal behavior in adolescence. I'll be talking from the perspective of a pediatrician. What you and me can do in a clinical setting would be my focus. Right in the beginning, I must acknowledge Samvad Nimhans where I did a course for children in conflict with law, and much of which I am talking about today is from what I learned from the course under the lead of Dr. Shekhar Sheshadri. So I think we all know that juvenile crimes are increasing. And if you see the latest National Crime Records Bureau report from 2023 itself, there has been a jump of 11.2%. And you can see even against the senior citizens, the crimes are increasing. I would urge all of you to read this editorial, which is available free. And it was recently, a couple of weeks, released on children in conflict with law and the society in crisis, which beautifully explains why are children in conflict with law and why is the prevalence increasing. Again, on 21st May, we had this news item saying that the Bangalore Special Home for Children in Conflict with Law is overcrowded as admissions hit record high. So, very worrying for us. And another news item which said a crumbling system in depriving India's young offenders of a second chance, because there was a change after the Nirbhaya case, a change in the Juvenile Justice Act, which said if adolescents above the 16 years of age were to commit adult-like crimes, their punishment is going to be much more severe and they would be tried as adults. Having understood the brain, is this the right decision? And this is indeed controversial. Dr. Sai Prasad shared this beautiful situational analysis, which Dr. Sandhya has already talked about, and I'm not going to go into the situational analysis any further, but definitely we will just go through this, how substance abuse leads to criminal tendencies. We know it impairs judgment, impulse control, it causes more aggression and violence, association with deviant peers, academic failure, family conflict, need for money to buy drugs, theft, robbery, trafficking, legal consequences, and repeat offending. And I think the most severe of all this is drunken driving, and which is one of the top causes of adolescent mortality globally. So we know how many adolescents first drive illegally, and that too under the influence of drugs. And we have had numerous cases both from low socioeconomic and high socioeconomic and middle socio, cross-cutting against all socioeconomic strata. Definitely, we have a role to play, and in fact, drug use is said to be the most common missed pediatric diagnosis. So, what are we going to do in the next few minutes? We have already gone through a bit of situational analysis, and we will talk a little bit more about data from India. We'll talk about vulnerable and at-risk adolescents to both substance use and crime, and in general to high-risk behavior. Why do we need to work in adolescence? What are the strengths here, and what is the vulnerability of this developmental phase? How do we fit life skills? And in the therapeutic context, we would discuss a case and we will try to go through about this case and how we could use life skill based counseling without any special training in counseling. We have not undergone what psychiatrists and psychologists go, and can we do something very simple in our clinical practice? And we'll talk about a few tenets of school based life skill program. So Dr. Sai Prasad had a very ambitious highlight for this session. So I must confess here that it's impossible to cover everything. But what we will be touching a little bit is on the risk factors, counseling strategies and life skills, and role of pediatricians in prevention. I promise to come back again to you with further screening tools and how do we really assess with a little next level of this. But today I'm going to touch on basics, and I think let us make a beginning today, because both criminal behavior and drug use are very difficult topics to handle in clinical practice. Though we know that criminal tendency starts with anger, aggression at home, and if that is not controlled, goes on to further criminal behavior, especially under the influence of drugs. And this is the data from very own Nimhans, which is they run a Swatantrata clinic. This is for children referred by the Juvenile Justice Board, and this is the paper that they published. And can you see the number one morbidity is life skill deficits, and the second is substance use disorder. In all these children referred by the Justice Board, children in conflict with law, along with psychiatric morbidity, neurodevelopmental disorders, and the other things which is very important is the family. Lot of family morbidities, both psychiatric and medical, socioeconomic strain, parenting concerns, neglect, abuse, bullying, school dropout, child labor, deviant peer influence, homelessness. So, all these things are contributing to children who get into conflict with law. Please remember the Juvenile Justice Act covers children in conflict with law and children in need of care and protection. Each child in conflict with law is a child in need of care and protection, and both of these are really interrelated. So when we go into the further into the vulnerabilities of these children in conflict with law, you can see child labor is right on the top, and deviant peer influences, academic difficulties, parental substance use disorder, lot of parenting issues, physical aggression, which is the norm here, intellectual disability, and parental mental illness. It is very important for us to know that it is not only about the child or the adolescent, it is also about the environment in which they are being brought up. Very same children, very few of them, just 60% of them had future orientation. And you know, future orientation is actually seen in the late adolescent period, and all of these adolescents were, most of them were 16 to 18 years old. Single parent child, pro-social skills, self-efficacy, stable peer relationship, supportive school environment, hardly less than 10% had, and supportive community groups, again very few, hardly 1 or 2%, and supportive relationship with a non-family member, very few, again 11%. So these were the assets, but very few of them had these assets. So you can see the children in difficult circumstances have more vulnerabilities and few assets. So these are children who are in a difficult. What about adolescents who are absolutely normal? Why are they geared to experiment? And we are all familiar with this functional MRI image, which shows the development of brain at various ages. And you can see the blue colors are more at the age of 20. The prefrontal cortex is the last to get myelinated, and the prefrontal cortex in fact gives the control to a highly reactive emotional center and the reward center. So these are very highly reactive. When they're happy, they're very, very happy, and they're seeking the dopamine kick. And especially adolescents in difficult circumstances, their limbic system is even more highly reactive, and their need for seeking dopamine kick is very, very high, and hence they seek quick sensation seeking behavior like drugs, violence, even risky driving. Adolescents in the early adolescent period, they have lack of formal logical operation and hence lack of consequences. What will happen later? Will I get a heart attack at a young age, or will I get cancer? This kind of understanding is really very less, because this center is again in the prefrontal cortex, which takes some time to develop. There's heightened stress response. So the cortisol hormone, there's a storm of cortisol hormone with a little bit of stress, and hence all adolescents need stress management techniques. And what is hot cognition? Now, the research has shown that adolescents by the age of 15 years are able to have adult decision making capabilities if they are in a very cool environment. But if they're under stress, under peer pressure, they lose this ability and then they make impulsive, risky decisions. Hence the importance of life skills of teaching them how to assess the pros and cons and make an informed, healthy decision, so that we hope that when they are under hot cognition or under stress or under peer pressure, they will be able to make the right kind of decisions. As I said before, it is not only about the adolescent, it is not only about the adolescent having a neurodevelopmental disorder like ADHD or learning disability or depression or anxiety. It is also about the family, where the family can provide support, where the community, drugs are not easily available, are laws being followed, are drugs being given to underage children, is alcohol being sold to underage children, is something which we need to think about. And are the policies which are so very good on paper, are they really implemented or not? Now, if I was to think about very simple things, what are the three main things that we need to target as a pediatrician when we want to evaluate the environment? We want to test whether they are peer norms, that smoking is normal, smoking is cool, and whether their peer norms that alcohol is a good escape to deal with stress, or marijuana helps us to deal with stress and we do not have any other coping mechanism. So these are norms and beliefs of the family, of the peer group, of the culture, of the society that need to be explored. Because if it is normalized, if parents all are drinking at home every day in the evening, the adolescent has easy access, and the adolescent says, well, I can drink. But as you saw, the development of the brain, even one drink or even one cigarette can cause addiction for life. So these are the norms that need to be explored. Again, stress and deprivation, poverty. So many of our adolescents live below the poverty line and they are on the street. Familial deprivation, also familial entitlement. On one hand, we have authoritarian parenting, physical violence. On the other hand, we have indulgent parenting, permissive parenting, where there are no rules. So these are some extremes that we see which push the children both into substance use and also violence. Financial stress, gender discrimination. We all know about academic distress, media influence, and relationship failure. This is a deadly mix which can push the children into alcohol use, into substance use, and even criminal behavior. What are the protective influences? And I think we need to work more and more on these: school and family connectedness, family welfare schemes. We know there's the Pradhan Mantri Yojana for so many schemes, the cash transfer schemes, which are really powerful ways to ensure community well-being. Religious attendance, spirituality, mentorship programs are all very, very familiar to our society, and we need to tap on them. Now, let me show you this framework which will help us to understand how do life skill deficits really come in these children in conflict with law who may also be taking drugs. So, emotional dysregulation in the family, externalizing traits, social disadvantages leads to attachment problems, neglect, and abuse. And we are talking about early childhood development here. And early childhood development has great implications on the development of brain in the adolescent period and later. And if there is child labor, where they have run away from their home, they are exploited, there is hardly any money that they are getting, there's the company of older persons. And this, if you remember, the juvenile in the Nirbhaya case was actually this kind of an adolescent who had low emotional dysregulation, who was on drugs. There was lack of empathy because their emotional center gets hit. Their prefrontal cortex is not developed adequately. So these children are emotionally dysregulated with lack of empathy. Many of the times they have neurodevelopmental disorders, psychiatric morbidity, temperamental issues, leading to life skill deficits and hence high risk behavior. All this was beautifully shown in the C Veda study of Nimhans. I will urge all of you to Google this. We have nearly 10,000 adolescents who were followed longitudinally, and they understood that the family environment, the physical environment, the difficulty of the adolescent age itself, especially in difficult circumstances, is a rider, is a driver of children getting in conflict with law. Having understood all this, I come back to life skills now. And life skills is only one part of the picture. Let me tell you that. And life skills for whom? Life skills for the adolescents, life skills for the family, life skills for the teachers also become very, very important. And what are life skills? They are tools needed to face challenges of life boldly, successfully, happily. They open the closed doors of mind. They develop emotional quotient, social quotient, adversity quotient, and even the environmental quotient. So life skills are extremely powerful. What does the WHO define it as? WHO has given its definition way back in 1997, and they said life skill education should be implemented in all schools. So life skills are abilities for adaptive and positive behavior that enable individuals to deal effectively with the demands and challenges of everyday life. So somebody punches you on the face. Do you punch back or do you report to somebody? Is something which we need to ask ourselves and also ask the adolescent. How bad was the punch? Do you need to react to it or do you need to respond to it? So the point here is you don't harm yourself, you don't harm others, and you don't harm property. So WHO has defined 10 core life skills. They are divided into social skills, thinking skills, and emotional skills. The social skills are communication, interpersonal, empathy, self-awareness. And the thinking are creative, critical thinking, decision making, problem solving, and emotional coping with stress, coping with emotions. So these life skills are needed for everybody so that they stay safe emotionally, physically, psychologically, and socially, and also spiritually, but especially children who are having difficult circumstances. Why do we want to develop life skills? Because we know that the adolescent brain is amazing and it is a work under construction. If we can teach adolescents how to adapt life skills, keep themselves safe and other people safe, this behavior is going to track into adulthood, because we know adolescents, if they do not use all their neurons to keep themselves calm, those neurons get pruned. And maybe in some adolescents who are having a difficult temperament, the neurons of intense anger, aggression, and violence get hardwired for life. Hence, the adolescent brain is amazing, and that is the real strength of the adolescent period. What do we want them to do? We understand that there are rapid changes in the biopsychosocial domains. All adolescents need life skills to cope up with these changes. We also know that there is a breakdown of the joint family system, more nuclear families, less of grandparents, less of uncles and aunts to teach life skills, and hence the need for doctors, teachers, and parents to learn life skills so that they can impart, because we don't have the social buffers. I already talked about the neurobiology. What is our aim? We are aiming for good health, good connection, safe and supportive environment, good learning so that they can be employed later, and lot of resilience and self-confidence. So this is what life skills will do. They're important for disease prevention, health promotion, and therapy. So life skills enable informed healthy choices online and offline, and this can be imparted anywhere, at home, at school, at Anganwadi. You can impart life skills everywhere, and we also know life skill deficits can lead to mental distress and disorders. Now, the best way to explain life skill, I love this, is the thirsty crow story. We all know about it and all adolescents know about it. So how did the thirsty crow overcome his need for thirst. So first thing was he was self-aware that I'm thirsty. If I don't get water, I would die. He had a lot of self-esteem that I need to survive. I'm very important to this world. My parents think highly of me, and so does my family. So what did he do? He took a deep breath. He coped with his stress and he started thinking. He thought of multiple options. He analyzed the pros and cons. When he thought of multiple options, he used his creative thinking. When he analyzed the pros and cons, he used his critical thinking, and then he took the right decision to put the stones and solve the problem, and thus he saved his life. And if I was to add on to another story to this, if there was another flock of his flock who were thirsty, what would this thirsty crow do? After quenching his thirst with a lot of empathy, understanding that the other flock is also thirsty, he would go and tell them this with good interpersonal skills and effective communication. So you can see that we have covered all the life skills. So what happened here? The thirsty crow did not go to drugs. He did not, out of frustration, harm himself. So he solved his problem, and with empathy he solved the problem of his friends also. So he kept himself safe and he kept his friends safe as well. Now, we all talked about children in difficult circumstances, so you would understand the stresses are much more in these children, and we have a complete list here: learning disability, neurodevelopmental disorders, orphan abandoned children, street and working children, HIV, those with chronic medical disorders, those affected by gender and sexuality vulnerabilities, children in conflict with law, children affected by disasters. All these children would need life skills. Now, life skill deficits can lead to internalizing disorders like anxiety, adjustment disorders, and also post-traumatic stress disorders. If somebody does not have a high self-esteem, does not have the problem solving and the stress coping mechanism, they may go into depression. Externalizing disorders, anger, aggression, violence, substance use, when they cannot cope with emotions, when they give in to peer pressure, when they don't have assertive communication, they can fall into this trap. We also know under the influence of drugs, there is sexual promiscuity and also bullying. So all these can be because of life skill deficits. So when we are doing counseling, if we can check on what are the life skill deficits, we can actually help these young adolescents. Now let me explain all this with a case. So this mother came to me a couple of years ago, and she said that she has found marijuana in the bag of her 16-year-old daughter, and she was extremely upset with her. So when she got the daughter to me, I took her aside, and I did, as I always do, a head psychosocial history, which we know is the norm in the adolescent age group, where we take history regarding home, regarding school, regarding friends, online behavior, and also if they have any suicidal behavior, any drug use, or how safe they are in an environment, or sexuality related issues. So this young girl told me that she wanted to get admission into IIT. There was too much of stress, and as she was not doing well in her studies, some of her friends had actually told her to try marijuana, which she had only tried once or twice, she said, and this was actually a gateway drug which could lead her into more hard drug use. And when I did a systemic examination and a mental health examination, there was no other abnormality. So this was not a child with a mental disorder. This child had mental distress. And this is how most of our patients present to us as we are pediatricians. Very rarely we do see the children who are taking drugs every day, and that is one of the signs of a severe substance use disorder, and which is beyond our purview and has to be referred to a psychiatrist. Now I come back to this case. How do we use life skills intervention for the adolescent? Now I would ask you to just remember this triangle. What is the context? Now, when we get, what is the context in this particular case? Like I said, I did a head psychosocial history, and she said she had a learning problem. She was failing in her exams again and again. She was in 11th standard preparing for her IIT entrance exam. Because she was failing, she was being teased by her friends in the school, and also there was emotional abuse by both the teachers and her parents. Her father had an alcohol use disorder. He was a schizophrenic, and he was on antipsychotic medication irregularly, and sometimes he used to have a lot of anger bouts, and he used to hit her. And her mother used to compare her with her elder brother, who was very brilliant and was settled in USA. So you see here, she had abuse from her teachers who were not happy with her performance. There was teasing by peers, and also abuse by the parents. And yes, she had used drugs, and she also confessed in anger once she had even hit her father, who was very high on alcohol. Now, do you think this is a setting for a further criminal behavior and substance use disorder? Yes, indeed, there is. And which are the life skills which are deficient? And you can see all the 10 life skills are deficient in this child. And if we could help this adolescent in developing her self-confidence, coping with stress, emotion, make the correct decisions, solve her problems, how to manage peer pressure, how to manage her emotions, and how to behave with others in a more appropriate manner, the problem would be actually solved before it gets into a bigger problem. So we have context. What is the problem? What are the life skills that we need to really train the child on? And what are the methods of learning? So unless we teach what she can practice, it is of no use. So what are some of the things which we can use? We can use yoga, pranayama, exercise, music, prayer, art, theater, storytelling, narratives. And always remember, we would need to partner with parents, teachers, and peers. So what did I do with this child? The first thing is this very useful diagram, which is called the identity exercise. I'm giving you some tips which you can use in your clinical practice for any child who feels that he or she is a failure. So we draw this diagram and we say, what are your fears and worries? What are your qualities and talents? And what are your roles and responsibilities? So this girl said, I am going to be really worthless because I'm not doing well in studies. I'm not going to get any job. I want to go into IIT, but I will be really, really hopeless. What were her qualities and talents? She was an excellent dancer and a very good musician. And she was very, very caring towards her mother and her father both. She said she had the responsibility of looking after them, especially because her father was not in a position to earn and her mother worked in a garment factory. So she had her roles and responsibilities. So as you look at this, the roles and responsibilities are huge. The qualities and talents are huge. The fears and worries are very, very few. So your identity is not only your fears and worries do not define your identity. They're only a very small part of it. And she had the quality. She wanted to do better in life and to improve. And she was feeling very, very guilty for taking marijuana. So, this is the first exercise you can do. What else do you tell the adolescent? You have to give information to the adolescents why no drugs. They are very familiar with the cardiovascular side effects, with cancer. That is what they have been taught. But what they have not been taught is the effect of drugs on a brain, and especially the growing brain. So I show them pictures like this. You can see this, the activity in a 15-year non-drinker and an activity in a drinker, how less the brain activity is. And this is NMR spectroscopy. There are punches in the addict's brain. And marijuana, though it is legalized in some countries, what can it do? There is a medical use for it. But in adolescence especially, it can, control of emotions is lost. Attention is lost, especially somebody who wants to do good in their studies. So in fact, it can really damage the brain in more than one ways. So this is very powerful way of giving them information why no drugs, and motivate them. You want to do well in studies, but this is what drugs do to your brain. So probably this is not the right choice. And as I said before, that adolescents, they do not have future thinking. So what do you tell them? Do you want to see a picture of an addict? And I often show them this baby gorilla's picture. I say that drugs can influence how you look. They can cause wrinkles, they can cause staining of your teeth, they can cause staining of your fingers. Image is everything, especially to a younger adolescent. And this is the way you counsel them to stay away from drugs and motivate them not to use drugs. E-cigarettes. E-cigarettes is on the rise, and e-cigarettes have enormous effect. And this is the infographic that I show them to tell them about the effects on the lung, effects on the heart. What does it do now? What will it do long term? And these are some of the facts. This is not to scare them, but to take their permission and share information. Only when they have this information can they make an informed decision. Coming back to this adolescent, we talked about stress. So how can you maintain health? That's most important. Getting good sleep, exercising for at least 1 hour, practicing meditation if you like it, eating healthy, connecting socially, connecting with nature. These are some of the things which you need to talk to them about, and this will actually help them in coping with stress. And sometimes doing the pranayama, we talk about the square breathing. You can do it with them in your clinic, and that's a very powerful technique. And sometimes you have to tell them, when you're coping with stress, you have to say things which are in your control, things which are out of your control. So what is in your control to improve your learning capacity and to improve your study skills? How can you do that? So this adolescent said, I have tried everything, doctor, but nothing is working. My studies are so tough that they're not making sense. I have nobody to help. Then I started asking her, who can help you think outside the box? Then she told me about Khan Academy on YouTube, which can help her with learning. Some of her friends were following that, so maybe she could try that. She also talked about an aunt who was staying out of the country and who was a scientist who could help her. She could also asked me if I could teach her study skills. So you know what we have done here? We have identified the problem. The problem here is studies. She's having problems with that. And who are the other people who could help her in solving this? She also talked about teasing, and she was so angry with her friends. She wanted to actually post on the social media some derogatory statements. And that's the time when I told her that the digital footprint never ever gets erased. So we need to be very careful. These are the friends who are teasing you, and we will talk about how to cope up with these emotions in the next session. So because studies was a big factor contributing to her stress, we talked about study skills first. And then I taught her some study skills about how to listen in the classroom, take good notes, schedule her time, concentrate, organize her homework, how to improve her memory, how to revise, and how to really take the exams well. And this was one of the most powerful sessions which made her feel very empowered. Her mother said that she really has a terrible meltdown, especially when her teacher scolds her, when her friends tease her, and also when her father shouts at her. So it's nice to sometimes partner with the parents and tell them that what is the normative growth and development. There is an emotional high here. Also tell them that how much you have loved her when she was a small baby, when everything was going all right. That same love needs to be given here. Please do not label the child. You can very well label the behavior, but not labeling the child, because once you label the child will not improve. So telling her about what she had done before, of maintaining that love and affection that connect. We always say first connection, then correction. Whenever she gets very down, she feels very, very down, she's getting very angry, or she's getting in a very, very poor emotional state, listen to her, empathize her, validate her emotions, and help her name the emotions. Once you name the emotion, your emotional reactivity comes down in the insula of the brain. My friends teased me today, and I am feeling very sad about it. So actually, she's not angry. What is she? She's feeling sad. She's feeling sad that nobody involves her in group activities. And how do you deal with this sadness is what we need to tell her. So what the parent has to do here is that to put the calm into the picture. Calm is in wisdom. The parents have a mature prefrontal cortex, and it's very, very important to listen to the child, not say, oh, sometimes your friends tease you, nothing to feel very bad about it. Imagine this is an adolescent who is in extraordinary distress, and we cannot invalidate her feelings. Her feelings need to be validated. Sometimes parents are not there, and then we teach the adolescent some tactics like abdominal breathing, which gets the parasympathetic tone into the process. Also, we say the most simple way to reduce stress and to get the parasympathetic or the vagal tone is the physiological sigh. Inhale through the nose, short breath, take a deeper inhalation through the nose again, and then let out a big breath, long breath out. This helps to decrease emotional reactivity in the limbic system. Even saying om or even saying ma, ma. So you put your tongue on your palate and just say ma. This again has been proved by MRI to decrease the emotional reactivity in the emotional center or the limbic center. When the adolescent gets into a panic attack, we tell ground yourself. Use your 5 senses to ground yourself. So what will happen? I'll fail in the exam. I cannot write my exam right now. So we say distract yourself. See 5 things that you can see, 4 things that you can touch, 3 things that you can hear, 2 things that you can smell, and 1 thing that you can taste. The moment the adolescent does that, they get grounded into the present moment. They don't go out into the future thinking that they will fail in the exam. Prayer is another very important and a powerful technique to calm yourself down. And as I told you before, she was a musician and she was a dancer. When you are under intense stress, your friends have teased you, your father has screamed at you. At that time, before you take the next step, it is very important to calm yourself so that you can respond and not react. So that is exactly what the thirsty crow did. And we tell the adolescent to do the same. Now, this is a mandala art made by one of my patients during COVID when there was intense anxiety. Some children like to draw. That's also a very powerful technique. Laughter, comedy is also very powerful. So is yoga. So is journaling. So all of these techniques help the adolescent to calm down. Once they calm down, they can think, what is the behavior which caused me intense sadness, intense anger? So when it was her father's behavior, we told her, is your father's behavior under your control? He's got psychosis. He's poorly controlled. He's having alcohol use disorder. She said, no, it is not under my control, but I can be empathetic towards him. I can probably tell my mother to take him to the psychiatrist on time, and I need to have more empathy with him. Is what she said. And she said, yes, I have to accept his anger bouts. I have to keep myself safe. When I see that he's in anger, I can move out. I can go out of the house so that he doesn't hit me. When it comes to my teacher scolding, maybe I can think in another way. And we said, yes, your teacher probably motivates you to do more. Your homework was not done, and that is why she scolded you in front of the other people. Can you use that as a motivation to do your homework each time now that you're using study skills? So the way you think about the particular incidents makes you feel better and calmer. And what about the teasing which the mother was comparing her? So she said, I get very, very angry with my mother. So I asked her, what do you want to do about this? Oh, doctor, maybe I need to tolerate. But like the thirsty crow, I think I should think of some solution. Doctor, what do you think? Should I go and talk to her? I said, of course. Please do. And then we use this mechanism called the feelings thermometer. So her mother compares her with her brother. What does she feel? Everybody feels differently. If something was happening to me, probably with a mature prefrontal cortex, I'll say, it's okay, my brother was great, I am okay, I'm not as bright as him, but I am not too bad either. But remember, for an adolescent, it is very, very hurting. So when she said, when my mother compares me, I feel 8 on 10. I am boiling. So I said, okay, so you're angry with your mother because she has compared you. But please remember, do not harm yourself, do not harm other people, and treat other people the way you want to be treated. So now that you've understood why you are angry and you want to go and tell her, please go and tell her in what way. Amma, when you compare me with my brother, I feel really bad. Please don't bring up history. Amma, you don't care about me. You always compare me. And Amma, I know my brother was very good, but I am a little different. And if you would just motivate me to do better and not compare, I would really love you a whole lot more. And then the mother takes a deep breath and she says, yes, Putta, yes, child, I also get stressed out. In that stress, I tell you things which I should not be saying. And then there is a whole lot of empathy between the mother and daughter, and everybody feels cool. So anger is like a pressure cooker. We know that it has to be released at the right time. And while we are speaking, remember, our communication style should be very assertive, because if we are passive, then it keeps on nagging in our brain. Oh, I must talk to my mother. My mother's always comparing me. I don't know why she does that, and then that causes a lot of anger, which is suppressed, and that can just burst out one day in aggression. So your mother is comparing you, don't want to go and hit her. Your father, who's having schizophrenia, is having alcohol use disorder, you don't want to go and hit her. So what do you want to do? You want to be assertive. And the same thing you want to do when your friends offer you drugs. And how do you say no to drugs? By saying no to drugs is saying, no, I don't believe in drugs. I believe that the stress does not get relieved by drugs. It gets worse by drugs. My doctor is helping me with study skills. If you are having a problem with your studies, please join me. I want to have fun with you, but let's go out and play badminton rather than take drugs. And if somebody really forces you, may you need to even sometimes yell and fight back. And always remember to form a drug-free group. Let me show you this video. It's just a 1-minute video on peer pressure. Can you hear it?
वही है बंदा।
Can you hear?
पिटाई की थी, आज उसकी धुनाई करनी
Yes,
है।
madam, yes, madam.
अरे यार, नहीं यार, वो हमारा इलाका के लौंडा है ना, उसके साथ पिटाई क्यों करना है? पिटाई के बाद कुछ प्रॉब्लम हो जाएगा तो वो अच्छा रिलेशन भी है उसका एरिया कॉर्पोरेटर के साथ, उसके पास क्यों हम पिटाई करें? यार, मैंने तेरी मदद की थी जब तू तकलीफ में था, और तू आज ये कह रहा है कि वो उसकी तरफदारी करे। कैसा दोस्त है यार तू? हाँ, कैसा दोस्त है? ठीक है, अगर तू बोल रहा है तो चल।
आज तो इसकी ऐसी पिटाई करनी है ना।
नहीं यार, मैं इसलिए आया हूँ क्योंकि तू मेरा दोस्त है और फिर तू मेरा
सबक
मदद
सिखाना है इसको। देख रहे कैसे घूर के देख रहा है।
हाँ, बोल रहा है तो अभी देखना यार, तू मेरा दोस्त है इसीलिए मैं तुझे बता रहा हूँ ये सभी, कि तूने बुलाया मैं आया, पर फिर भी तुझको ये जानना है ना कि वो पिटाई करेंगे उसका तो पुलिस की लेफ्ट है, उसके बाद कॉलेज से रेस्टिकेशन हो जाएंगे, और फिर उसके बाद और एजुकेशन खराब हो जाएगा। देखना यार, एक काम करते हैं, अगर अगली बार ये करता है ना तो प्रिंसिपल को हम ही जाकर कंप्लेंट करेंगे।
So you can see that how a peer can give alternative modes of action to a person who's very, very angry. We also often talk of negative peer influence, but here there is positive peer influence. And when I talk about sexuality, drugs, I said, can cause sexual promiscuity. Very important to teach the adolescent about how the sexual desire and attractions are normal at this age. How can we maintain privacy? How do we have to respect consent, boundaries, have healthy relationships, take care of health and safety, and protect ourselves from abuse and protection? This itself is a course of 7 days. And those of you who are interested in life skills, I will urge you to read these two modules, which are available free. And this is Social and Emotional Development and Gender, Sexuality and Relationships by Nimhans. And these are excellent modules. What about the Government of India? The Government of India, as we know, has RKSK, has Nasha Mukt Bharat Abhiyan, which is a very powerful program of the Government of India. There is also the M Cessation program, Quit Tobacco for Life. And here there is a number where adolescents can call up and they would get a program to quit tobacco. There is also the substance support with substance use disorder, the toll-free helpline. Sometimes adolescents don't like to come to us, and in a life skill session, we must cover these. Sometimes telling adolescents to make posters, like I am one of the majority of high school students who don't smoke tobacco, gives them a lot of dopamine kick and makes them feel good about themselves. By Nimhans, there is this app called Mind Notes for Wellness. There is also the help available through Telemanas for all mental disorders. And we must also tell the adolescents about the anti-drug law. So all these things need to be covered in a life skill program. So what happened to this young girl? This young girl, with all her life skills being reinforced, decided not to go into the path of drugs, controlled her anger, and did not get admission into IIT, but she did get admission into RV College of Engineering, and now she is a very successful software engineer, and her marriage has just been fixed. So this is in a clinic setting and a very successful resolution of the case. We can do these life skill programs in schools, but we must select the group carefully, preferably the same age or those who are in having similar distressful situations. It could be children in conflict with law or natural disasters. We must set the group norms, structure the session, plan the session well, implement it, and document. We must set the group norms of respecting each other, listening, not passing comments, helping each other, maintaining trust and confidentiality. Preferably sit in a circle position so that everybody can talk to each other. The structure of the session should be nicely outlined, and this is given in all the life skill modules. What is the icebreaker? What is the introduction? What is the activity? Like I said, the drawing activity or the relaxation techniques. What is the conclusion? What is one thing that you learned today, and what would be doing in the next session? We must also document the session, because this will help us to analyze whether the responses were good, what were the powerful moments in the session, what methods worked, what did not work. Is there any Indian studies to substantiate what I'm saying about life skills? Yes, they are. I put two of these studies here. Life skills is a very powerful way of improving overall mental well-being. What is so important in life skills? Life skills teach the adolescent to press the pause button. And that is what is so difficult in this period because their prefrontal cortex is not yet mature. But if we teach them again and again, remember their neurons will wire together, which fire together, and that is what is our aim. Between stimulus and response, there is a space. In that space is our power to choose our response. In our response lies our growth and freedom. It was said by a very famous, very renowned psychiatrist, Viktor Frankl, and this is exactly what life skills teach us. So the key points are drug use and crime in adolescence on the rise. I already told you there are multiple contributory factors. Vulnerable are at risk, especially those who are poor, belongs to slum areas, are on the street. We must evaluate biopsychosocial profile and environment. We must help them. We must build hope and collaborate with parents, teachers, and the community. We must separate the adolescent from the behavior. Remember, brain is under construction. Show empathy. We can empower adolescents with life skills. Let's do it together. And these are skills we can take wherever we go in life, no matter what we do. This picture was taken from the first life skill program that I did in my clinic. This was done way back in 2005. And many of the adolescents whom you can see here are doctors, entrepreneurs, scientists, engineers, and whatnot. A very, very powerful group which have really done well in life. As I end today, I would also tell you that on 31st of May is the World No Tobacco Day. And the theme this year is Unmask the Appeal, Countering Tobacco and Nicotine Addiction. Why? Because nicotine pouches are now on the rise globally. So they are put in the mouth and adolescents are not smoking, right? They're not using e-cigarettes. They are using these pouches and these are flavored pouches. Nobody knows what they are using. And this is what we need to guard ourselves. So I would urge all of you to make every day World No Tobacco Day and World No Drug Day and World No Crime Day. Thank you so much.
Wonderful, madam. It is just like a Rajmouli movie, like a Bahubali of our AP AHA sessions.
Thank
It's
you.
wonderful.
Thank you.
Very wonderful, madam. I would like to have one question for you. What is adversity quotient, madam? Can you explain a little more for that?
Okay, so adversity quotient is we often try to protect our children from troubles in life. Like, so adversity quotient tells us that how do they bounce back from failures. So, for example, if they're running a race, we always tell them win the race, right? So sometimes we say, doesn't matter if you lose the race, you continue to run. Right? Didn't you enjoy being a part of the race? So it starts like this. So we tell them, we allow them to make failures in safe environment so that they get confidence. Right when they're small, we talk about scaffolding. When they're making a tower with cubes, sometimes it falls. But then we say, I'm here with you, I'm going to help you, and we'll do this again. So these are the small things which make a lot of difference. A small child asks you for a chocolate, and you keep giving the chocolate each time. And the child doesn't know how to accept a no. And you don't give the chocolate once, a child cries for some time, and then you say, you had too many chocolates this time. We have decided that we will give chocolate once a month. Right? So this is how we start teaching them how to overcome adversity so that when they have a relationship failure, when they grow up, when they fail in their exams, later, they do not give up on life. Right? And they know how to bounce back.
Thank you, ma'am. Recently, I got one child, an adolescent child. He is in first year politics. Actually, his father beat him because he started smoking with his peer group. And what happened is most of his friends were arrested by the police because they are consuming heroin. So he was very distressed and he came to my clinic. and he was having a conversion reaction also. So that is happening in the surroundings. No, it is available everywhere. No, all the substances are available everywhere. Recently, we conducted 2 or 3 sessions in the colleges. I conducted, and we called this police department people also. What about the law? And we did so. We are doing for the last 1 year the substance abuse. You have given an epitome of the session. Thank you so much, madam.
Thank you.
Raja
Thank you,
Ramesh.
Dr. Sai. I
Madam,
feel that, once we talk about substance use, we must look for the driver. What is driving that? Because usually we always just focus on, you're taking substance that's not good for you. This is not, but what is driving it? Can we help them in any way to overcome their distress or to overcome the peer influence which is pushing them into this? And that is what becomes really, really important.
Peer
very
influence and
session.
self-join, madam.
Yeah,
Let
very
us have a
excellent session, madam. Very practically useful. Ma'am, one
Thank
question,
you.
little bit deviation from this topic. Now we are seeing more of like a functional or conversion cases, especially stomach pain, headache, or abdominal pain. Majority are, we know that is a functional. We cannot prove it. How to counsel them, ma'am? Like it's a how to make aware them like that you are normal. You are why are you doing like this? How we have to do that?
So what, Dr. Ramesh, I don't know what is the age group that you're talking about, but we are also seeing this in very young children also, like,
Now we are see last 4 years onwards. 4 years
yes,
onwards.
4 to 5 years on. That's what I was going to say. 4 to 5 years onwards, we are saying. Now, I have seen from my clinical experience, most of these are related to familial conflicts. Parents are having a tough time in managing their emotions. There are a lot of fights going on. There could be also fights between the grandparents and the parents, and which the child is picking it up, soaking all that, doesn't know what to do. So I think sometimes what we have to do is talk to the parents separately, right? Or talk to whoever is coming. Sometimes, most of the time, father does not come. It's a mother who's coming, right? So, are there any stresses? Are you facing any issues? It's a good question to ask sometimes. I'm worried about you. And, so we say from 7 years onwards, they will be able to tell you what are the issues. So, sometimes taking them aside and saying, how are things at home? You know, what is happening in the house? So things like that, you have to ask these questions, because unless we can't say they're normal, because they're actually not normal, right? There is something which is driving it. Then sexual abuse is another thing which is often missed. So that is another thing which you must, always kind of screen, especially for the younger children. And then academic distress, especially these ADHDs and learning disabilities in lower classes who are mild, do very well. But as they come into higher classes, they are not able to cope at all. And that is what they get missed about. So these are some of the broad things, but we have to talk to them one on one. Media. So I can't tell you how many times media is a big influencer. There was a child who was seeing these scary movies. So the scary movie gives them a dopamine kick, but it also scares them. So once we stopped the scary movies, the abdominal pain went off. So, so the head psychosocial history actually helps us in exploring lots of the domains of an adolescence. So, even for every child, the family, the school, the online, very, very important. At least this much we should be able to, family, school, media. This much we should be able to kind of screen. If we are able to screen this much, I think a lot of stressors we would be getting them and picking them up. And some things are very simple to solve, actually, to tell you frankly.
Thank you.
Sanjay?
Thank you, madam. That was really a wonderful, wonderful session. And the thing, brain under construction, that was such a sensitive comment. I really like that. Just asking us to be more empathetic, no? Because the
Yes.
child's brain has not been optimally developed yet. So we have to treat it gently. That was such a nice observation. Thank you, madam. That was really, really wonderful.
Thank you. Thank you so much, Sandhya, madam. Thank you.
I want to make one comment. Am I allowed?
Sure, sir. Sure, sir.
Yeah,
Please.
your passionate talk makes you becoming adolescent from your that
Thank you,
itself
sir.
is a motivation for children. The way you
Thank
come
you.
down to their level and then try to counsel.
Thank you, sir. Thank you, sir.
Madam, there is a question. If an adolescent is having suicidal tendency, how to counsel? That is a
Okay.
question.
So this is a big session in itself, I would say. Yeah, yeah. But so see, one thing is very clear as a pediatrician, you should keep in mind this child has to be referred to a psychiatrist, right? Having said that, I would also say that please read our IAP guidelines on management of suicidal behavior, which are available in Indian Pediatrics 2022, I think June issue. Now, what do you do? Three things a pediatrician can do, which we should be doing, because just saying refer to the psychiatrist is not enough, because they may not reach the psychiatrist. And there's so much of mental health stigma attached to the going to a mental health professional. What do we need to do? First, we need to reassure, right? That hope is available, that help is available, and there is hope that you would improve, right? So we are not telling that I'll be able to solve all your problems or things like that. No, I'm not telling that. What I'm saying is help is available. There is hope that you will get better. That is the first thing which a pediatrician should be saying. If you are lucky enough to pick up the stressor, like I said, in this case, learning disability, right? Or poor school performance. And if you have a little bit of counseling skills and you can think that you can help in relieving the stressor, or if there's a family conflict, and sometimes, children feel that the parents are fighting because of them, and then they self-harm themselves. If you can find out a cause and if you can deal with it, that will be excellent. But if you're not able to find a cause, and sometimes they do not tell, you must make a safety planning with them. Right? And what are the components of the safety planning? We write it down. I have it all written in the clinic. I have a printout of that. And again, in that article, you can take out a printout and keep it handy in your clinic. When I have distressful thoughts, then what can I do? Which are the people I can talk to? What are the things that I can do? What are the phone numbers of these people? Because as I said, adolescents are impulsive. If they're impulsive to really try a suicidal kind of a behavior, they're also impulsive to stop it if they're given help at the right time. And the third thing is lethal means counseling. Suppose an adolescent has taken an overdose of antihypertensive of the parents. You have to make sure that that medication is out of reach. If an adolescent has used a knife, then you have to make sure that all sharp objects are out of their reach. So these are the three things which you used to do. And I just saw antidepressants. Now the question of antidepressant comes is there an indication for it? Now antidepressants have a very specific indication, and that is moderate to severe depression or moderate to severe anxiety, right? So if we are able to or post-traumatic stress disorder. So are we able to diagnose that? If that is your diagnosis, and if you have the expertise in diagnosing, like I said, head psychosocial history, we can do patient health questionnaire 2 for screening depression. We can do scared 5. It's just 5 questions to screen for anxiety. We can do problematic internet use scale, PRIS scale. That is just 3 questions. So we have shorter versions. In fact, you can do it in 10 questions. You can screen for depression, anxiety, problematic internet use. If there is any of these problems, then probably antidepressants have a role. And again, I will urge you, if you have a psychiatrist who's close by, and you can develop a partnership with that, under their supervision, you can do it until you get more expertise and more confidence in using the antidepressants on your own. Because remember, antidepressants, what they do is when there's severe depression, the depression gets lifted, and then there is a high chance of actually again indulging in suicidal behavior because they become more motor active, right? So they need close monitoring. So if you're starting for antidepressants for depression, again, suicide behavior has to be closely monitored. I hope I've given you in brief
Thank you, ma'am. Thank you, ma'am. That was an excellent explanation, ma'am. Actually, recently I had a BTech studying student whose father had a second marriage, and after that, the stepmom, she was having some conflict with her, and she took some medication. She was telling us she's taking medication. She told the parents that I took some overdose, but she told us that no, I haven't. Just I want to scare my parents. So she had repeated admission. She has been So we are counseling her. So I want to know the role of antidepressants in this situation. Thank you so much, ma'am.
Welcome, Tanvi. Welcome.
Umesh, if there are no more questions, we shall conclude this session by saying a good and big thanks to Madam with huge claps.
Thank you. Thank you so much. Thank you so much, Dr. Sai. Thank you so much.
Thank you.
Thank you. Thank you. Bye-bye and good night. Thank you. Thank you for inviting me.